These days, we hear a lot about the rotating diamond. What is the rotating diamond? It's a medical tool similar to a drill or a boring bit. It has a metal tip with diamond pieces embedded on it. It spins at high speed inside the patient's arteries and opens up vessels that have become very hard and stiff due to calcium deposits. Hello, I am Dr. Habibi. I am a cardiologist. Today, I want to talk about two of the most advanced and fascinating tools for opening heart vessels, namely the rotating diamond and the intravascular lithotripter. You might ask why we need this method. Because not all blockages that occur in the heart vessels are soft. Sometimes, due to calcium deposits, the blockage becomes as hard as cement and as solid as a rock. So, simply inflating a balloon or placing a stent won't open it. What is the rotating diamond? The rotating diamond, or scientifically known as the RotaBlator, is a medical device. It is a tool similar to a drill with a metal tip that has diamond particles embedded in it, and through angiography, we guide the tip of this drill or the rotating diamond until it reaches the heart vessels. The other end of the rotating diamond remains outside the patient's body. We connect it to a set of special electric motors. After we turn on the motor, it starts to rotate at a very high speed, over 200,000 revolutions per minute. This diamond starts to spin, and when the rotating diamond begins to turn, it acts like a drill bit, shaving away the part that has become completely hard and stone-like. By shaving it, it moves forward, which allows us to open up the narrowed vessel. Now the question is, why is diamond used? Because diamond is extremely hard and tough, and as you know, even in drilling bits used for oil extraction, they use bits that have diamond tips. Because at great depths, both the temperature and the pressure are very high. Therefore, the material used must be able to withstand all this heat, all this temperature, and all this pressure without being destroyed. That's why diamond is used. If you found the video helpful so far, please like it and share it with your friends. And if you don't want to miss my future videos, please subscribe. Now, you might be wondering if this rotating diamond has any side effects. Yes. When it spins at a very high speed, about 200,000 revolutions per minute, it releases a lot of energy and gets hot, and this can potentially damage the vessel wall. In addition, it could even lead to the vessel rupturing. And ultimately, its most significant side effect is that the pieces of calcium or those stony deposits that have built up in the heart when shaved off turn into powder. This powder can travel to the far ends of the vessel and cause blockages in the small blood vessels. It can produce symptoms similar to a heart attack. Another point about the rotating diamond is that it is designed in such a way that it only shaves off and removes hard tissues, like that calcium. But when it reaches the softer parts of the vessel, it stops there and usually does not cause any damage to the vessel wall. But still, sometimes damage is unavoidable, and it can even cause the vessels to rupture. What is a vascular lithotripter? A vascular lithotripter, scientifically known as IVL or intravascular lithotripsy, does the same thing as the rotating diamond. That is, in cases where the coronary artery stenosis is very hard, cement-like and rigid, we can use this method as well. But its mechanism is different from the rotating diamond. In these patients, angiography is also necessary, and then we insert a special device into the heart's vessels. A balloon is mounted on it, and this balloon has a property that intermittently transmits sound waves to the vessel wall. With repeated and alternating pulses delivered to the vessel wall, it causes the calcified layer to break, and then we remove the balloon. We place our stent and are confident that the stent will now open sufficiently and to our desired size, effectively opening the vessel. Now, do these two methods themselves have different applications? The answer is that both of them are used to open calcified stenoses. But if the amount of calcium buildup is very high, completely surrounding the vessel, and the vessel diameter is less than 2.5 millimeters, and on top of that, the vessel is very tortuous. In that case, the IVL method, or intravascular lithotripsy, is preferred. However, if the vessel diameter is less than 2.5 millimeters, has less tortuosity, and the calcium buildup is focal and localized, then rotational atherectomy is preferred for these patients. Now, how effective are these methods? If these methods are used precisely, scientifically, and in the right context, they are over 90% effective and can successfully open narrowed coronary arteries. Another question that often comes up and is frequently discussed on social media is whether these methods are a substitute for open heart surgery. In other words, if we use these methods, does the patient no longer need to undergo open heart surgery and have their arteries bypassed? The answer is no. These methods are not a substitute for open heart surgery because only a small number of cases in which we refer a patient for open heart surgery are due to excessive calcium buildup. There are other reasons as well. That means even if there isn't any calcium buildup for other reasons, the treating physician and cardiologist may decide to refer the patient for open heart surgery instead of performing angioplasty.